I've always been one of those guys that was always healthy. I grew up in Southern California. I was a multi-sport athlete. I played football at the University of Colorado, and I've never had any trouble with my weight or any issues with my health. In about mid-2015, I started feeling some what I thought was back pain, but I realized shortly after that it was too low for back pain, and I started to suspect that I had prostatitis.
All of his numbers were good until he got to the PSA, and that number was exceptionally high. When Tom got his diagnosis, not only was it surprising, because he had always been such a healthy, athletic guy, but it was terrifying, shocking, stunning.
The oncologist that I had at the time took my wife aside and was not very optimistic about the outcomes here. In fact, he started talking to Debbie about things like palliative care and hospice and things like that. I changed oncologists. I changed cancer centers altogether. My new oncologist took a totally different tack to it. He says, Tom, I want you to know that there are a lot of tools in the toolbox, and there's not a single one we can't use on you.
Tom's PSA started to go up again. And his doctor had always promised him that he was on the cutting edge of all research and things that were coming along that would be beneficial to Tom. And he recommended very highly that Tom receive a treatment of Provenge.
The earlier that you start Provenge in the stage of cancer that I had, the more likely I was to have a good outcome from it. I did have a few manageable side effects with Provenge. The day of the pheresis process, I got very fatigued and would have to go home and kind of lay low, take a nap. I had a little bit of joint pain, but those were really about the only things I experienced. I'm also seeing my oldest grandson getting ready to drive, and these are milestones that are kind of fun to be a part of. So that's really been important.
Indication: Provenge, Sapulus LT, is a prescription medicine used to treat certain men with advanced prostate cancer. Provenge is an established cellular immunotherapy and is customized to each individual by using his own immune cells. Important safety information. Before receiving Provenge, tell your doctor about any medical conditions, including heart or lung problems, or if you have had a stroke. Tell your doctor about any medicines you take, including prescription and non-prescription drugs, vitamins, or dietary supplements. The most common side effects of Provenge include chills, fatigue, fever, back pain, nausea, joint ache, and headache. These are not all the possible side effects of Provenge treatment. Provenge is made from your own immune cells, which are collected during a process called leukapheresis. The cells are processed, returned, and then infused back into the patient through an IV, intravenous infusion, approximately 3 days later. This process is completed in 3 cycles about 2 weeks apart. Each infusion takes approximately 1 hour and requires 30 minutes of post-infusion monitoring. Provenge infusion can cause serious reactions. Tell your doctor right away if you have signs of a heart attack or lung problems, such as trouble breathing, chest pains, racing or irregular heartbeats, high or low blood pressure, dizziness, fainting, nausea, or vomiting. Have signs of a stroke, such as numbness or weakness on one side of the body, decreased vision in one eye, or difficulty speaking. Develop symptoms of thrombosis, which may include pain and or swelling of an arm or leg with warmth over the affected area, discoloration of an arm or leg, shortness of breath, chest pain that worsens on deep breathing. Have signs of an infection, such as a fever over 100 degrees Fahrenheit, redness or pain at the infusion or collection sites. Tell your doctor about any side effects that concern you or do not go away. For more information, talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see accompanying full prescribing information.